that we are following, and hopefully there'll be clarity across the board. Where we have organized in an emergency management system response capacity. When you have a statewide situation that requires immediate government action and coordination among different agencies with local governments, that's our emergency management system protocol. We have a New York State task force that has been working on this, which has obviously been interagency. These are the members of it. Some of them are here with us today. You see who's on it, who's not. Rob Mahiga is not on it. He's been focusing on the budget. Three basic areas that we have been operating on: the testing priorities, quarantine, and containment tracking. And we'll go through them quickly. On testing priorities, first priority for testing is people who have been in close contact. We define close contact as within 6 feet of a person who is known to be positive. Second, people who have traveled to a country with level 2 or 3 travel health notice from the CDC and is experiencing symptoms. Third is a person who's in quarantine and has developed symptoms while in quarantine. Fourth, a seriously ill individual who has not tested positive for other viruses. So when the person has gone into the hospital, they run the viral screen, doesn't test positive for any other viruses, then test for the coronavirus. Fifth, any other case in which, in the opinion of the healthcare professional and the local health department, they believe requires testing. So they would call up and consult with the Department of Health on that one. Quarantine, there's two types of quarantine. We keep going back and forth between the word quarantine and isolation. Let's say they're basically synonyms, but isolation is the technical word. So it's really mandatory or directed versus what we call precautionary. Mandatory quarantine: anyone who tests positive, anyone who has been in direct contact with a person who's tested positive, anyone who's returned from a country CDC level 2 or 3 and is experiencing symptoms, any other person who their health professional and the local health department believes needs to be quarantined, and they'll speak to DOH to make that determination. That's mandatory quarantine. Precautionary quarantine: you return from a country with CDC level 2 or 3, but you are not symptomatic, okay? That's precautionary quarantine. Proximate to a person who is positive. Proximate, not direct. Direct is within 6 feet. Proximate exposure is, I was in a car with a person, I was in the office with a person, etc. Third, any person who the local health provider and the local health department thinks should be quarantined, and again, they'll consult with New York State Department of Health on that. The last system that is operating is containment tracking. We're mapping all these cases, we're analyzing them, we're investigating them. Every time you get a positive, you run that case back to see who else could have been infected. And we are communicating that. The number of precautionary quarantines at 4,000 statewide. You can see the list there. It's basically all across the state. Obviously heavier in New York City and in Westchester. 2,700 New York City, 1,000 Westchester, and then 115 Erie, 70 Nassau, Tompkins 15, Suffolk 15, Albany 11, Broome 4, and you can go right down the list. Schenectady 12, Warren 6. mandatory quarantines, 44 statewide, New York City 9, Westchester 33, Erie 1, Nassau 1. In terms of new cases, yesterday we had 22 cases. Today we have 33 cases, so it has gone up by 11. There is one new case in New York. That is a case where a person is tested positive. It is connected to the Westchester case. 3 members of the Young Israel congregation connected to the Westchester case. All of the new cases are connected to the Westchester case. 2 friends, 2 people in Rockland County who worked at the bar mitzvah, and 3 patients, 3 people connected to the visit at the Lawrence Hospital. That brings, those are 11 new cases, 22 goes to 33. Just a general context question. The number will continue to go up. I've said every day the number will continue to go up. The number must continue to go up because it is mathematics. The more you test, the more positives you will find. And remember, we're predominantly testing people who have a higher probability because they're in the chain of contact with a person who has already tested positive. So people see the number go up and they say, oh, the number's going up. The number has to go up. The number can't go down, and the number has to go up because we are testing, because we find people who are testing positive. That's how you find the person infected, quarantine them, and reduce the infection rate. Also, some of the sum up what I have been saying. Cuomo urges calm. I'm not calm. I'm urging reality. I'm urging actual response as opposed to an emotional response. I'm urging that people understand the information and not the hype. We have more people in the country dying from the flu than we have dying from coronavirus. All the experts say 80% will self-resolve, 20% may get ill, may require hospitalization, and for senior citizens, people with immune compromised situations, with an underlying illness. The fact of our own experience, okay, I don't believe anyone, okay. The fact of our own experience, we have 33 cases. 5 of the 33 are hospitalized. 5 of the 33. That's about 15%. Verifies the about 20% may be hospitalized. Of the hospitalized, they are immune. So those are the facts. What are we concerned about? Senior congregate facilities, people with compromised immune systems, those are the populations we most protect, which are also the populations that are most affected by the flu. That's why I go back to this is like a flu on steroids. You catch it the same way, the target who's most vulnerable is the same. Flu season says to me, you should shake hands. Why? Because so it's the same precaution. Look at the facts. Look at the facts. I know this is a great issue on all the TV stations and everybody has an opinion. Look at the facts. If you look at the facts, facts calm.
How many tests actually performed? I know Doc, you said capacity was about 200 a day. What's the total number we've done?
I have give you exact number.
Do you have an estimate? Are we talking
No, we've done dozens of tests.
dozen?
Exposure, obviously, continues, these cases continue. It seems like there's who is one of them? I know you don't want to people. There seems like there's a doctor. Can you talk at all generally about the exposure in that case, and whether there's concerns that this doctor might have treated patients who are, then at least a whole other set of questions.
As we've been saying, this community spread. So you can deal with a community that deals with a school, or whether it deals with an office, or it deals with a family. And so to get into the specifics, this is why we go back and we track this. How close was someone? How were they? Are they to follow up and test for?
What do you do at Metro North, right? I mean, we know the one traveled on Metro North. How do you start? What do you start going back and seeing what train that person was on? They were on an 840 train from New Rochelle to stuff like that.
Well, a couple of points here, Joe. First, remember we were more motivated. So healthcare professionals, for example, nurses, et cetera, they're in a situation than they were. They're in a different situation weeks ago. This one. They're now fully. Second, you test and track every lead. That's basically what you do. And we're looking for positive results because it means we have identified the infection. The Rochelle is how you can gathering can get affected, just like the flu. 500 people in a gathering, and number. So for seniors, if you are you take precautions and be just going for every. You today, Joe. Is 80% self-response, not a immune.
So.
On them.
Hundreds, Jesse, because we have State Department, and then you have coordinated by the State Department of Health. There are basic. There are monitoring requirements if you're under mandatory quarantine. One person be a random in-person check that you are in your from a. But there are only, what did we just say? Quarantine, so tremendous workload. Also remember on the, I'm trying to communicate facts because facts here, but there is an undue anxiety, so we're also trying anxiety. And taking all the, you mentioned North, affecting trains, metro. We have local agencies doing it. some of this, in retrospect, you may wind up saying, you know what? The ultimate consequence and then be saying, well, why did you do it? If the ultimate consequence was going to be, and to do in the moment, reduce spread.
As resources at Buffalo State versus, but right now, whether or not they have an option for quarantine, precautionary quarantine at home, or whether they will need to use a facility.
Governor, how would you characterize your relationship right now in communicating all of this with? I know there was executive bars over people going so.
Very well. I've been local officials, highest number. It's a case of first impression. Not done this before, this on the public health system. We have done stabilizations on floods, hurricanes, activity. Their way a little bit. Between communicating and they will pause, and that's why there's pause. Is response.
Does anyone, our partners across
in the city, day 9, yesterday that, which was the who came back from my. How did the state get you? Said that their conditions